This video was produced by the MBRRACE-UK Perinatal team at the University of Leicester and was commissioned by the Healthcare Quality Improvement Partnership. It's to accompany the MBRRACE Perinatal Mortality Surveillance Report for births in 2013. I'm going to explain why we've had to exclude babies born at 22 and 23 weeks gestation from the mortality rates we calculate, but why it's vital we include them in the future. Very few women deliver at 22 or 23 weeks. It's about 1 in 1,000 births every year. But as their survival is so poor, with many of them living only a few minutes, they actually make up 1/5 of all neonatal deaths, that is, babies that die in the first month of life. There are big differences in the registration of deaths at this gestation, as only deaths to live-born babies are officially registered. Babies showing no signs of life, that we refer to as a late fetal loss in this report, are not officially registered. Stillbirths are only officially registered from 24 weeks gestation onwards. This difference in registration means that the parents of a baby born alive at 22 or 23 weeks, but who dies shortly after birth, will receive an official birth and death certificate, and this will mean they're included in national mortality statistics. The parents will be eligible for maternity and paternity leave, maternity pay, child benefit for 8 weeks, and free prescriptions and dental care for the next 12 months. In contrast, the parents of a baby that shows no signs of life at 22 and 23 weeks will receive no official death certificate and won't be included in mortality statistics, and the parents can only take sick leave from work and will receive no other support. In the UK, we've identified that how babies are registered varies between clinical teams, depending on whether these babies are perceived as being viable. Consequently, a death in one area may be seen as live-born but dying after a breath and registered as a neonatal death, whereas in another area that baby would be seen to be a late fetal loss and be unregistered. In some areas, babies are 4 times as likely to be registered as a neonatal death rather than a late fetal loss compared to other areas. This variation leads to biased comparisons of hospitals, since a hospital that registers more of these babies as live-born can have an artificially higher mortality rate. Also, it means large inequalities in access to support for parents, because if the same baby had been born in a different area, the parents would have had a very different experience in terms of the support they receive at this difficult time. It's vital that in the UK we have full data on all deaths occurring to babies born at 22 and 23 weeks gestation, including those babies born showing no signs of life, so that we can ensure in the future we can make better comparisons of NHS organisations and identify organisations that provide good care and implement their practice elsewhere. We can reduce the inequalities seen in support for parents, and ultimately we can improve the care of all babies and their parents, including those born at this early gestation. If you'd like to know more about the report, you can access and download either the full report or the lay summary by going to this website. Thank you.